Hi, my name is James Andriella, and you're listening to the Back to Human podcast. On the show with me today, I have the pleasure of hosting return guest, Dr. Anthony Chaffee. On our last episode, we talked about Dr. Chaffee's personal experience with athletic performance while on a carnivore diet, along with what the research shows in regards to elite athletes thriving on ketogenic diets, why carbohydrates are so addictive, and how we use the same terminology for sugar as we do drugs, and the devastating effects that chronically elevated blood sugar has on the body, why it's so damaging to the body. And in this episode, we dive into two important topics: how a carnivore diet can be approached by those living with type 1 diabetes and by individuals dealing with gallbladder issues. We'll be exploring the unique challenges that these people face and some practical adjustments that they can make in order to make this way of eating sustainable and effective. Without further ado, Dr. Chaffee, welcome back, brother.
Yeah, thank you so much for having me. It's good to see you.
Good to see you, man. All right. So, for those that don't know, what is the importance of gallbladder? We're gonna start there. What's the primary function of the gallbladder, and what are some potential issues that people can be dealing with?
So the gallbladder's main function is to store and concentrate bile. Bile is made from the liver, and eventually it's used to digest, break down, and then emulsify and absorb fat. So fat is very important. I mean, this is how we know fat is very important because our body has 5 organs all working in concert just to absorb fat. The stomach breaks it down. Gallbladder makes bile. Gallbladder stores it. Liver makes bile. Gallbladder stores it. Pancreas makes enzymes like lipase to break it down, and the small intestine absorbs it. So all of those things have to work in concert just to absorb fat. And if one of those systems breaks down, we can't absorb fat. We'll get malnourished, and we can get very sick. And you can even die from those sorts of malnutrition. So the gallbladder is a very important role in that because it stores the bile and it concentrates it. So physiology textbooks will even say that it will concentrate up to 20 times its normal concentration when it comes out of the liver. This is very important because your liver is constantly making bile, but we're not constantly eating. We're not constantly having access to food out in the wild. And so predators such as humans may not be able to get a kill every day. Humans have been lucky in the sense that we've figured out how to dry and store meat and be able to have stores of meat and fat at any period of time, even when we haven't gotten a kill for a long time. This is where things like the buffalo drops, where Native Americans would chase a herd of buffalo over a cliff and they would have meat for the year. They'd dry it, mix it with meat, make pemmican, which was very high fat, 2 grams of fat to 1 gram of protein. And so they could have access to meat every day. However, not everybody does. And so you might hunt and have an animal and be able to eat for a few days or a week or two, and then maybe you go a week without being able to get something to eat. So you still need the same amount of fat. Remember how important fat is. So you have to concentrate that bile because if you don't eat for 5 days, you still need the same amount of fat. You still have the same demands for those nutrients. And without bile, you really can't absorb fat. About 90% of the fat will go out of your body if you don't have fat. You'll just lose it in your stools. So the main purpose of the gallbladder is to store and concentrate bile so that when you do get that fatty meal, you're able to absorb all of it in one go. Now, how that can affect us now in this landscape of fat is bad for you, don't eat fat, is that that bile can continue to get more and more concentrated. And if you're not eating fat, that will get more and more concentrated until finally it can start forming precipitates and even crystals. So anyone who's taken high school chemistry, they know that any hyperconcentrated solution at rest will start to form precipitating crystals. And that's what bile sludge is. That's what gallstones are. And so you can get gallstones, you can block the bile duct, the common bile duct, or um, at other points as well. You can get pancreatitis from this. You can block the pancreatic ducts as well. And this can cause very serious issues and even death if it's not treated surgically. The thing is, though, is that if you're eating enough fat, meaning that you're eating as much fat as your body is making bile for, so as much fat as your body is asking for, then it's actually physically impossible to make a gallstone, because if you're eating enough fat every day, then that bile is not sitting in your gallbladder getting more and more concentrated. It can't. So it can't turn into a stone if it's not there. And so I actually have patients who are actually reversing their gallstones and not needing surgery, actually shrinking their gallstones down and then passing them out once they're small enough and not needing surgery in the first place. Once you have stones of a particular size, the risk of getting those things stuck is a real possibility. So it could be that these things shrink down enough, but then they go out and they can still get stuck. You might still need surgery. But if you don't eat fat, then you're definitely going to need surgery down the road because those gallstones will just get bigger and bigger and bigger and eventually cause inflammation and possibly infection and things like that. So those are sort of the main things to know about with the gallbladder.
Mhm. So the gallstones form because it's overconcentrated and it's from essentially a lack of use.
Correct. Yeah. So yeah, it'll just keep your bile there as long as it needs to because fat is essential. And I mean, they're essential fatty acids. They're essential fat soluble nutrients and vitamins that only come in animal fat. You can't get them anywhere else, like vitamin D3, K2, retinol, DHA, EPA, choline. All these things are essential and very important for health. And so your body is anxiously waiting for them. So it really just comes from not eating enough fat to meet our physiological demands.
Now, this can be a bit tricky because I have a few clients that are actually dealing with some of these issues personally,
Mhm,
and their hesitance to start incorporating more fats
mhm,
is because when they do eat fat, it really messes up their digestion. Like it's
mhm,
painful. So
mhm,
you're saying that you see people that are reversing their gallstones.
mhm.
Is this like a process where they need to just introduce fats at a very, very slow rate, like
Mhm.
gradual? And, how are the gallstones then passed? How do they get out of our body?
So you certainly can, and if you're getting a lot of pain, it's good to listen to your body, and so maybe try easing into it, try having a little bit at a time, and seeing how that goes. Um, the risk is that if this is just a little sack, and so it squeezes that sack, and that's what's hurting because now it's squeezing on something solid, and it's not supposed to be
Mm,
anything solid there, and so your body's going, "Oh, what's that?" So it's quite painful, right? And the sort of the
yeah.
right upper quadrant there under your ribs. And the thing is that that's not necessarily gonna cause harm. If it irritates the gallbladder, then yes, that might cause inflammation, might get inflamed, you can get cholecystitis, and that might be a problem. But the the way that they would be passed would be sort of twofold. One, they could start to dissolve, and I've seen this because I have a patient that has a 4 millimeter stone in her gallbladder, so that thing's not coming out. It's too big.
Mm,
It's much bigger than the opening out of the gallbladder. And but every sort of 3 months or so, we get an ultrasound, and it's down about 4 millimeters, so half a centimeter. So it's sort of shrinking, shrinking, shrinking slowly. Eventually, that can get small enough that it can sort of get pushed out and passed out through the common bile duct. And then you just pass it out in your stools. But if it's big enough to get out of the gallbladder, but too big to get all the way out into your intestine and get stuck at the sphincter of Oddi, which is sort of the outlet into the intestine, then it could get stuck, and you might have to get an ERCP, which is a camera down the throat, and they go in there and snake out and take that
mm.
thing out. So you might actually need a procedure anyway. So there's no way to predict that, unfortunately, but there are a lot of people that are able to pass these. Now, if the stones are small enough that they can pass freely through the common bile duct and get out into the intestines, then you should be able to just pass these out. I mean, in fact, there's sometimes people do like a gallbladder cleanse or they call it a liver cleanse, but have all these different sorts of herbal whatevers and basically a cup of olive oil, right? And so you just drink down this glass of olive oil because again, when you eat fat, that stimulates the gallbladder to just pump out a bunch of fat. So you're eating a lot of fat to stimulate that. And sometimes people are seeing this in their stools. They're seeing 20, 30 little gallstones in their stools coming out after they do something like that. You risk those things getting stuck. I mean, that's the reality of it. But as long as you know the symptoms, so if you're getting pain and that pain is not going away and it's just sort of still going, or your the whites of your eyes are getting yellow, your skin's sort of getting yellowed, that can mean that you're actually blocked and you're getting a backup of that bile and you're getting jaundiced. As you get that
Mhm.
yellowing of the skin, yellowing of the eyes, and you're having painful jaundice. You have a lot of pain, and you have, the yellow coloration to your eyes and your skin. But a lot of people, they can dissolve certainly the sludge that can just come right out. The gallstones can start to dissolve as long as you're not continuing to concentrate the gallstones by eating some fat, maybe just eating a little bit of fat at a time, like you said. If that is comfortable for them, that's great. Just eat a little bit of fat multiple times throughout the day and try to get rid of that excess bile. And as a result, you're going to get better nutrition as well because you're going to get fat and the fat soluble vitamins that you need. And eventually you can start clearing some of these out, start dissolving these down. It can take a long time. They're stones or precipitate, so they're very concentrated. And so, like in my patient that I mentioned before, that has a 4 millimeter, or had the 4 millimeter stone, that was shrinking by about 3 4 millimeters every 3 months. So if that can give you an idea of how long these things can take. But I have several patients who have had multiple small stones, and then they've eaten, and they had a bit of discomfort, but then it started to go away and started easing up, and they were able to eat large fatty meals. And then you get a scan a year later, and there's nothing there. It's all gone. It's all cleared out. So it's either sort of dissolved down, and then gone away, or more likely dissolved down to a point that they're small enough to then pass in your stools. But there's always that risk that you can get one of those suckers stuck. So it's really important to know the symptoms that would make you go into the hospital and need to get something cleared out. But the thing is if you avoid fat, you're almost guaranteed to have a problem down the road because it's just going to continue to concentrate and get built up, and you're just going to get full of stones, and eventually that's going to be a problem, and eventually it's going to have to come out.
Mhm. So you said that surgery, for some people may be inevitable depending on how
Mm.
large the stones are and the symptoms. Would that be just passing the scope down and taking the gallstones out, or would that
Mhm.
be a complete removal of the gallbladder?
If the stone gets stuck in the bile duct or the common bile duct, then it you can get it with just a camera down the throat called an ERCP, and they sort of snake this thing up the common bile duct, and you can sort of try to get those stones out. And if if the gallbladder itself has become inflamed, you get cholecystitis, and there's an infection, then typically you want to consider taking out the entire gallbladder. If it's just a stuck stone but no cholecystitis, you don't necessarily have to take out the gallbladder at that point. If the gallbladder is full of stones, they might recommend it. Say like, look, we're here, we might as well take this thing out because eventually you're going to have to get it out anyway. But you don't necessarily have to get it taken out anyway. You could pass these stones and you could dissolve them enough that they pass very easily, and they may not get stuck. They may not cause cholecystitis. I've several patients that have not had to do that, and I've spoken to many more people all around the world that I've spoken to online that have had that same experience. So it's not a guarantee that you're going to have a problem, but it's just that risk is there, and and so you should at least be aware what those symptoms are if you do get a stuck stone or you get cholecystitis so that you can get the help that you need, because those can be life-threatening conditions. But if you're not eating the fat and you're not clearing these things, at some point you're going to have you will get cholecystitis, you will get very serious problems, or a blocked stone because they're just going to keep building up.
Yeah. So how would someone without a gallbladder, say for instance they've already had it taken out,
Mhm.
how would they be able to approach a high fat carnivore diet? Would the liver be able to produce enough for them to actually be able to digest the food?
Yes, so the liver will still produce bile, they just won't have a gallbladder to store it and concentrate it, so you won't be able to eat large fatty meals at one time in the beginning stages after your surgery. Many people form, after they get gallbladder surgery, form what's called a pseudo gallbladder, which is just an outpouching of the common bile duct, and it acts exactly the same as a bile duct or as a gallbladder. And so that actually means that they don't have to do anything differently, and they might be able to eat large amounts of fat in one go. If you don't have a pseudo gallbladder, or before you've formed a pseudo gallbladder, you will likely need to split up your fatty meals. Yes, you can absolutely eat the same amount of fat. You're just going to need to eat it at multiple times during the day, maybe four, maybe five times a day, and you just go by your bowel motions. So if you can't absorb fat, it goes out into your stools, and well, 90% of it or so will go out in your stools, and that keeps your stool soft if it's a small amount of fat, or that'll give you loose stools if it's a large amount. And so if you have a fatty meal and all of a sudden you're running to the bathroom 30 minutes later and you're having a problem, okay, well that's a good sign that you're eating more fat than your body can absorb at that time. So you just cut that down, try to eat a little bit less and then spread that out throughout the day. So you're still going to eat the same amount of fat throughout the day because your body still has a specific requirement for fat, and it's going to make the specific amount of bile for the specific amount of fat it wants. I don't think your body's guessing on how much bile it wants because it's not just say, oh, we'll just do a random amount of bile so we can get a random amount of fat nutrients. Doesn't make sense. Nature doesn't guess. Your biology doesn't do that. It's very efficient, and bile is an expensive resource. And so you're not just going to make a random amount of bile to get a random amount of fat. So keep eating fat, but split it up throughout the day. And if you start getting loose stools, just eat a little bit less next time, and you can gauge it on that. But a lot of people form a pseudo gallbladder, and so eventually down the years, they may not actually have to do that anymore.
Hmm, I didn't know that was possible. Like the body, as you
Yeah.
said, it doesn't really make mistakes. I heard someone years ago mention, "Oh, my friend just had this surgery. They had their gallbladder removed. We don't need it anymore." I'm like,
Mm,
why are you saying that? Like the body, we wouldn't be honest if we didn't
mhm.
need it, if it didn't perform some type of function.
Yeah. Yeah. Exactly.
What about ox bile? So I've heard that that
Mhm,
can help people that do not have gallbladder or they have an issue with producing
mhm.
bile. Would that be able to help them?
Yeah, I mean, it's very rare that you'd actually not be producing as much bile as your body actually needs, and it may be that just given time, that that I mean, that's the other thing too. I mean, some people who are eating a very low fat or no fat diet get gallstones, and others don't. So maybe there could be a down regulation of the amount of fat that or bile that your liver is making because you're like, look, we're just not getting fat. We're not going to keep making this resource and wasting our time. Some people might concentrate things more than 20-fold, things like that. So for people that are eating more fat and start eating more fat, it could be that your liver starts upregulating um, fat and things like that. Um, sorry, remind me what the first question was because I was going somewhere with that.
So about ox bile supplementation.
That's right. Yeah, yeah. Sorry. Um, it might be that if you're not producing as much bile at first, you're not able to absorb as much at first. Sometimes that can change. You can actually start increasing the amount of bile that you're making, and so you can tolerate a lot more fat because your body's saying, "Okay, well, we're getting enough." It's very rare that your body's just not really producing bile. That's usually in the cases of cirrhosis or extreme liver disease, where your liver just starts become dysfunctional. So other people that don't have that extreme level of liver damage, typically you should be able to make enough bile. Now that might upregulate as you go, but I would just let it. I would just listen to your body, and again, your body knows what it's doing. The I tend to not recommend people do ox bile because if you're just eating the amount of fat that your body has bile for, then you can't overeat fat because you can eat all the fat that you want, but you'll only absorb what your body wants, and everything else is going to go out in your stools. And so yes, you might have loose stools, but it's not going to be too much fat because it's not going to do anything to your body physiologically because you're not absorbing it. Right? It's not like you had too much alcohol and all of a sudden there's a problem. Like you just don't absorb it. And
Mhm.
so if you're having ox bile, then that forces that, and so that changes that. So maybe you do have too much, and then really what's going to happen is you're just going to store that in fat, and you're just going to put on weight. Um, but if you were careful about it, like if somebody with who had their gallbladder taken out and really can't handle more than a little bit of fat at one time, and for like logistic purposes, they just said, "Look, I'm going to a wedding or there's some sort of big meal, and I really want to partake, and I just can't handle all the fat that's going to be there." Taking some ox bile in that situation for that specific event, fair enough. But I would try to avoid that. because you don't know exactly how much your body wants in fat. And so taking the ox bile is sort of a guess, and you're sort of guessing about how much your body actually wants. And so it could be too much. And, if you have a sort of an idea of how much fat your body absorbs throughout the day, and you have your gallbladder taken out, you're sort of having to eat 5 times a day to get all that in there, and that's just a real pain. Then you can sort of see about, okay, this is sort of how much fat. Okay, I'm gonna take a certain amount of bile. I'm just gonna eat that all at one go and try to take enough. I mean, you could do that, sort of figure it out, but I think it lends itself to issues about absorbing more fat than your body actually wants, because normally you have that release valve, you have that overflow valve where your body just won't absorb it past a certain point, and you can overwhelm that by adding in ox bile. So if people are using it, I would use caution with it, and I would sort of do it in that ways. But I typically don't recommend people use ox bile unless they really need it.
Mm. Possible to overshoot it essentially, which
Exactly.
we'll kind of get into in like the type 1 diabetics as well.
Mhm.
So you mentioned also that we can't really absorb fat soluble vitamins, so vitamins A, D, E, and K. What potential issues then can we face if we are not getting these? Because vitamin K2 it takes calcium out of the arteries and put it in the bones,
Mhm.
the teeth. So
Mhm.
osteoporosis, things of
Mhm.
that nature may
Yeah.
be prevalent in
Yeah.
people that do not consume fats.
Yeah, and same with vitamin D3. If you're not getting that, it's more difficult for you to absorb calcium in the first place. And then if you don't have enough K2, then you can't use that calcium properly. So it's they work together. That's why D3 and K2 generally come together in supplements, in supplement forms. Vitamin D3 is actually a hormone. It's a very important hormone. It has over 1,000 physiological effects in the body and the brain. It's really important. It's very important for neurological function. In fact, people that are trying to regrow damaged myelination brain tissue with multiple sclerosis, there are treatment groups that prescribe 100,000, 200,000, 300,000 units of vitamin D3 with K2 in order to try to help rebuild and regrow their myelination. I've found that just putting people on a carnivore diet, optimizing their B12 and vitamin D and choline, creatine, carnitine, DHA, EPA, all those sorts of things actually helps reduce those lesions as well. And we're getting ready to publish a case series of people who have done just that. And so the problem is that when you have deficiencies, your body can't work properly. You're not going to be able to regrow your myelination. And we say, well, that doesn't happen anyway. Like, not in the normal population because everybody's B12 and vitamin D deficient. And so, yeah, you're definitely not going to regrow your brain if you don't have the constituent um, vitamins, minerals, and building blocks to make your myelin sheath to regrow your tissue. Like if you don't, if your B12 is so low that you're actually getting demyelination, what do you think the odds are of regrowing your myelin sheath from MS? It's not going to happen, and that happens at a much higher level of B12 than people think. We think of B12 deficiency at under 150 picomoles per liter, or under 200 picograms per milliliter that we use in the U.S., but actually under 500 picomoles and 600, 650 picograms from the US numbers. Below that, Oxford University published a paper in 2008 that actually showed that your brain can actually shrink by 2.5% every 5 years if you're under that threshold. And if you're under 300 to 400 picograms per milliliter, then it actually shrinks by 5.5% every 5 years because of that demyelination effect. You're losing your white matter and your brain is shrinking. And we say, oh, look at that. Your brain is shrinking as you age. That's normal age related atrophy. I don't think that's the case. I think that's malnutrition over time. And so, how are you possibly going to, for in the case of MS, how can you possibly regrow your myelin sheath that's been damaged by MS if your B12 is so low that you're actually getting further demyelination and brain shrinkage? It's not going to happen. And so that's why, in the current understanding, your brain tissue really can't regrow. It can't develop. But I am seeing it happen in practice. I'm seeing people's brains grow on MRI after several years of doing this and optimizing their nutrition. And at least, to some degree, and certainly shrinking these demyelination areas. Vitamin D is a very important part of that. You don't have enough vitamin D, you can't repair your body. It's important for immune health. It's important for neurological health. It's important for bone health. It is extremely important for development. So kids in particular really important that they have enough of these fat-soluble vitamins. Dr. Weston A. Price was a dentist 100 years ago, and he traveled around to different indigenous populations, and he found that the fathers and grandfathers and older people had perfect teeth, perfect dental arches, and all their wisdom teeth, no cavities, anything like that, because they're eating their natural diet. And any creature's natural diet will never damage their teeth. And that's how you know that the crap we're eating right now is not meant for us. That's how we know that carbohydrates are not meant for us, because carbohydrates breed for the bacteria that cause cavities and rot our teeth. No animal eats food naturally that rots their teeth. Otherwise, they lose their teeth and they die because they can't eat. So if you're eating something, anything that's rotting your teeth and causing cavities, you know for a cold frozen fact that is not meant for your body. Oral health is a window to your overall health, especially your cardiovascular health. And a lot of those bacteria that are bred for by eating carbohydrates actually show up in arterial plaques in heart attack patients, actually show up in GBM brain cancers, actually show up in all these other sort of disease pathologies. So this is a very serious issue. And Dr. Price found that the children of these people that had perfect teeth, all of a sudden they had fallen dental arches, they had smaller jaws, crooked teeth because teeth are the same size and they're just coming into a smaller space, so they go all crooked and just trying to get in wherever they can. And so he found that sometimes even siblings, this one would have perfect teeth and that one would not. And there was the one that was not was eating more of a Western diet. So these are people that were transitioning into a more Western diet, which is a more plant-based diet. And they weren't getting the right nutrients. So he started supplementing them with animal fats, raw milk, raw cream, butter, meat, and fat. And he actually reversed these issues. He actually found that people's jaws and teeth were actually started straightening out, and their hard palate started developing more normally, and their teeth straightened out, and they started getting better. And overall health improved, and development improved as well. So he theorized that there were some fat soluble nutrients that were involved in that and required for normal facial development. And he's right, because now in current modern dentistry journals, it says explicitly that crooked teeth are not genetic. No teeth or jaws found before agriculture, prior to the agricultural revolution, were found to have crooked teeth, cavities, or small jaws, things like that. That happened directly after the agricultural revolution and within generations. It didn't take hundreds of years or thousands of years. So the dentistry journals now show that the main key ingredients for developing your mouth is K1, K2, D3, and calcium. Those are the main ones. Most often people are deficient in K2 and D3. You can get calcium to a degree from plants, while there's a lot of anti-nutrients, things that block that out. And K1, you can get that from plants as well. But K1 doesn't convert into K2. It's like a 1% conversion. So you're not getting enough. So you have to get this from animal fat, really. And the sun, D3 comes from the sun as well as from animal fat. And what have we been telling people for the last 50 years? Don't go in the sun, don't eat animal fat. And so we're getting a lot of deficiencies, and kids are needing braces. They're not able to develop properly. No one's getting their wisdom teeth in because our jaws and face aren't growing to our genetic design. Even though I ate a lot of meat, we always were sort of trying to limit the fat and things like that. And I almost got my wisdom teeth, but I didn't quite get them. So I had to get those things taken out. So that sort of bugs me, right? Because I didn't develop to my genetic potential and in that way, but obviously that means other ways as well. You know, uh, going by the fossil record, I should have been about 6 inches taller with a brain 11% larger, and I would have been about 50 pounds more muscular, and I would just been absolutely crushing people on the rugby field, and that would have been great. But, it is what it is. So the deficiencies in these things can be multifold. It's not just your teeth and your mouth. Vitamin D, for instance, if you don't get enough vitamin D during puberty, you won't get the secondary sexual characteristics of your body that you would normally get. And so for vitamin D3, what that does is it broadens men's shoulders or boys' shoulders into men. So you get broader shoulders and then sort of narrow waist. You get that classic V-shaped bodybuilder appearance. And then women sort of narrows their waist and broadens their hips. So they get that classic hourglass figure, which is probably why there's so many bikini models from Brazil, because they eat a lot of meat and they go in the sun, right? So they're getting a lot of vitamin D, and they actually have that form, which is actually our normal genetic form. And so now you see a lot of people in their 20s and they could be quite androgynous, and they're they're quite just sort of stick figures of boys and girls. They just have the same body. It's just a stick figure, and not everybody, obviously, but it's something that we're seeing more and more because we're encouraging people to avoid the sun, avoid meat, avoid animal fat, and we are not developing properly, and we're not differentiating our bodies. Low vitamin D is associated with higher rates of cancer and infectious disease. Um, and low choline is associated with lower IQ, especially during development. Women that eat more animal fat and more choline, like egg yolks have a lot of choline, they find that their children objectively have significantly higher IQs. And they say, okay, well, if you supplement up to like 430 milligrams of choline, that this will have that during pregnancy, that the children will have significantly higher IQs than those who did not. But then they said, okay, well, in a recent study that just came out, I think just this past year, they said, okay, well, is more better, or is that just the threshold, and that's as good as you're going to get? And so they jumped it up to 960, I believe, was the study, and they compared that to 430, and the 960 group had significantly higher IQs in the babies that had the mothers that were eating more than 900 versus the 430, which already had a significant improvement compared to controls before. So this is really important for your brain health and brain development. All these fat-soluble nutrients are extremely important. Um, if you want, actually, I had something up because I was showing somebody earlier,
Sure.
um, but I could show you this, some pictures of some brain scans, and sort of hammer that point home about brain development, how important this is.
Absolutely.
Do you want me to is it possible to share the screen? Or,
Should be able to. Let's see.
here, I'll send a request.
There we go.
Okay.
Mhm. Hmm. I'm glad you brought up the teeth because I personally
Mm,
experienced before switching over to keto years and years back, my teeth were terrible. Like I had
mhm,
multiple cavities. I needed to go in for a cleaning and I had bleeding gums.
yeah.
And literally as soon as I started just pounding butter, I
Mhm,
regrew. I never had to have any teeth removed. Um,
nice.
I also noticed that, as you say, yeah, it's like our teeth no longer fit our jaws. That's what we're told anyways. Like we just don't have wide enough jaws anymore due
Yeah,
to genetics. But
yeah,
with traditional like Chinese medicine, I'm not well versed in this enough to really even talk about, but I know they um, correlate certain teeth to certain organs. So if the teeth
mm,
are rotting, I'm like, well, this may be reflective potentially of those organs. Like you don't just have a cavity, that organ system, that whole line, whatever it may be, is failing. Like the circuit's going
mhm,
out.
yeah, and yeah, and the thing is that the idea that it's genetic is a bit silly because 100 years ago, most people were getting their wisdom teeth in, and so our genetics don't change that quickly. They
Mhm.
just don't. And so that's again, it's in the dentistry journals right now, that if you're eating meat that is a bit more to it, as opposed to processed foods, it's just mush, you're using, mushy peas and things like that. You're not working your jaw and using that, you're not developing your hard palate properly, and you're not going to stimulate the jaw and the facial bones to develop normally. Also, mouth breathing versus nasal breathing actually changes your facial structures as well. And then not getting those essential fat soluble nutrients is really important. That's in the modern dentistry journals now. So it's not so people that are still saying, oh, that's just genetic, really haven't looked into it as much as they should. Yeah. So here, I'll share this. Can you see that?
Uh, yes.
Yeah. So this is just a CT scan of a brain. This is a 20-month-old baby brain. And so you'll see here, you don't really see any black around the edges, right? Um, so these are the ventricles, these are little slits in the middle. You sort of see little touches of the temporal horns there that might be around the pons. So very little space is the take home here. There's a lot of brain here. There's no space around the outside. It's this big, nice, healthy, full brain. This would be like a 40-year-old brain. This would be quite typical for, say, a 40-year-old brain. So the ventricles, you can see them; they're pretty clear to see. You see more on the ventral horns there, and you see this space around the outside of the brain. We normally say, oh, well, that's normal, having a bit of space, that gives a bit of cushion, all that sort of stuff. But there's still a bit of space. Okay, so that's a bit atrophied down, and you see a bit more spaces there. Okay, so it's not like that baby's brain was just completely flush and full. And then you have this brain over here, which would be pretty typical for like a 70, 80-year-old brain. Much bigger ventricles, huge gaps and spaces around the outside. And you might say this person might have a touch of dementia. But you look at that, if you showed that to a radiologist and you said, okay, that's an 80-year-old patient, no neurological symptom, just having some headaches, what would they say? And they'd probably look at that and be like, well, there's normal age-related atrophy. So you have bigger ventricles, bigger temporal horns there, and I've seen, you know, hundreds of MRIs just like that in normal, quote unquote, healthy older adults, and it gets reported as normal age-related atrophy. But again, if your B12 is 500 and you're losing 2.5% of your brain per year, or every 5 years, that's 0.5% per year. In 40 years from here to here, you might actually lose that much brain. And let's say it's lower than that, then your B12 is 300, and your doctor says, yeah, your B12 is fine. It's well within the reference range. But you're actually losing 1.1% of your brain per year. It might actually be 20 years by the time it looks like that. You might be 60 or 70 and your brain is looking like that. And the thing is that the reason I really think that this is malnutrition over time is because these scans right now are actually malnutrition, because that's not an 80-year-old brain and that's not a 40-year-old brain. That's actually the brain of a 6-month-old little girl who was a child of vegetarian parents who had B12 deficiency. So that's what her brain's supposed to look like. It's supposed to be all brain, no space. Without B12, the brain can't develop properly. You can't get that white matter developed properly. So the brain looks like an 80-year-old Alzheimer's patient who probably had an alcohol problem, right? So that is a very, very dysfunctional scan. And this other scan here, the one that looks like a 40-year-old brain, is after 5 months of daily B12 replacement. So this was a case series or a case study that was published in it's published in pediatric radiology, and they found this big recovery, and that's great. I mean, that's really improved that child's life. But that brain looks like a 40-year-old brain. It doesn't look like a 1-year-old brain like it should.
Mhm.
And so that baby probably won't develop to its full genetic potential. And the problem is and also this was on breast milk, by the way. People don't necessarily realize that, but then when vegetarian and vegan mothers don't have necessary nutrients, they cannot pass on to their babies what they don't have. And nature will select for the mom and not the babies, because if you give all your nutrients to the babies and the baby survives but you die, baby's dead anyway because you're the one
Yeah.
taking care of the baby, right? So they will select for you to keep, like, okay, this is the minimum amount of these nutrients that we can keep you at. We can't pass any more, even if the baby dies. And there are more and more stories coming out in the news and things like that show that vegetarian or vegan mothers, their babies are actually dying from breastfeeding, which is absolutely tragic. They're trying to do the right thing for their child, and they're just so malnourished that they can't survive, and potentially getting some of these toxic components in there as well that the babies just can't handle. So that's a 6-month-old baby girl who's breastfeeding um, because baby formula has B12. Because people understand, like, you need B12. So that's actually on breast milk. And then they give daily B12 for 3 months, massive improvement. Sorry, 5 months, massive improvements, massive growth in their brain, which is great. But the problem is they are still vegetarian. And presumably they stayed like that. I didn't see any indication in the case report to say they didn't. So they just replaced the B12. Well, what about the D3? And the choline, the creatine, the carnitine, the DHA, the EPA, saturated fat, cholesterol, those sorts of things are all essential for normal brain development. And this is probably why when we switched to agriculture, the average brain size shrank by 11% for men and 17% for women, because we're not getting the correct nutrients to grow and develop our brain properly. And we're seeing hard evidence of that right here. And so that's why I think this is because if you flip this around and say, okay, it's not a 6-month-old, but what about a 40-year-old and an 80-year-old? Well, if you're not getting enough nutrients, you can actually reverse engineer that, and you can actually say, "Hey, that's gonna turn into that eventually." So that's why I think this is age-related. This is not age-related atrophy. It's not just your brain just rotting out of your head just because you're getting older, because no other animal on Earth does that when they're healthy and when they're eating their normal diet. It's just humans, and because we've just had CT scans, brain scans very recently in the last several decades, we just said, "Oh, well, this is what it looks like when people get older. Their brain just sort of shrinks down." And just because it's common doesn't mean it's actually normal. It doesn't mean that's supposed to happen. And so that's a very important distinction to remember. So yeah, and I do think you can actually regrow it, because I mean babies' brains are much more plastic, but adult brains are actually pretty damn plastic too. It's just that we're not providing the nutrients that we need to regrow and rebuild our nervous tissue. But I have seen dramatic improvements in people's neurological symptoms. I mean, recovering from 30-year-old strokes and actually improving their motor score after having right-sided weakness for 30 years. As a friend of mine, Dave Mack, had that experience, and 3 months on a carnivore diet, and all of a sudden he's not limping as badly, and he can run upstairs, and he's not falling all the time. So it's incredible what the body and the brain can do when it's actually stimulated properly and nourished properly, and you have the essential nutrients for your brain to regrow. We're seeing it regrow, and so that's excellent. And I think this is very encouraging. Unfortunately, very sad for this young girl, but hopefully she's doing fine. She's obviously doing a lot better now than she was before. But I think that's a clear sign that the body is more than capable of making up for lost time, to at least to a certain extent, and rebuilding and regrowing past where they were before, once they get proper animal source nutrition. And every single one of those nutrients that I described are all only found in animal source nutrition, and typically in animal fat. And we have been vilifying fat for so many long years, saying that fat is bad, don't eat the fat. Even now, sometimes in the carnivore community is, oh, you don't want to, if you're losing fat, you don't want to eat fat. That's the same tired garbage advice that people have been giving for the last 50 years that didn't work, got people fatter and sicker than they've ever been, eating less fat. And now, when people are eating more fat, they're getting more nutrients, they're improving their health, and they are losing weight. So remember, fat is not just a calorie source, it is a nutrient source, and these are essential nutrients that are required for your brain. If you don't want your brain to look like that, eat the damn fat.
Damn, man. You had me on that one. I really thought that was like an 80-year-old brain, and then all of a sudden just
It looks like one.
like, and I was
Yeah,
gonna
I mean,
ask
that
you if
is what an
it's
80-year-old brain looks like. That is exactly what an 80-year-old brain looks like. A normal age-related atrophy 80-year-old brain. That's what it looks like. But yeah, it's really important to understand that, and I think that's gonna be a game changer when you get people that are actually eating properly and getting proper nutrition. Their brains are not gonna atrophy like they did before, unless they have some sort of degenerative process, but hopefully they don't. But at least it won't be degenerating from a nutritional standpoint. And you
Mhm.
optimize your B12, you optimize your vitamin D and everything else, and you will be a lot better off.
Yeah. I was gonna ask, you already answered it, if it's possible to get enough fats from a vegan diet, say if you just consume copious amounts of coconut, for instance, but
Mm.
clearly that doesn't seem to be the case, and I've seen some high profile accounts that are vegan with children, and then you look at the
Mhm.
kids,
Yeah.
and they just look like the lights are off. It's really, really
Yeah,
sad.
that is sad. Yeah, the problem is that I mean, there are fats, and there's even saturated fats that can be pretty healthy for you in things like coconut oil, avocado oil, but they don't have those fat soluble nutrients that you can only get from animal fat. So D3, K2, A, E, choline, DHA, EPA. They'll have some omega 3s, but they're the wrong omega 3s. We don't just need omega 3s broadly, we need specifically DHA and EPA. The omega 6 we need is arachidonic acid. We don't need the plant version. We don't need linoleic acid. In fact, linoleic acid can be quite harmful. Some of that will convert into arachidonic acid, which, yes, we use, and yes, it's essential, but we don't need the linoleic acid. We need the arachidonic acid, so we need the animal fat version of that. The plant versions of omega 3s are ALA, alpha linoleic acid, as opposed to DHA and EPA. And the best case scenario, you're getting about 5% conversion of ALA into DHA or EPA. And some studies show it won't actually convert at all. Other studies show that the more ALA you consume, the lower your DHA and EPA go. So it's really important to get the correct fats. And unfortunately, you just can't get those on a vegan diet. Even taking fish oil supplements, those sorts of things, or even if they're really staying vegan, trying to get the algae oil and things like that that will actually have DHA and EPA. These things are not very stable outside the organism, and they can break down and oxidize and become rancid, and then they're not as healthy. They're not as good. So even the fish oils, there's independent studies that show up every now and then. They just sort of check them, and 80% of the fish oils were found to be rancid by the time they hit the shelves. And so, and there's 200 pills in there. If they're not rancid by the time you buy them, if you don't put them in the fridge directly, within a week or two, they're all going to be rancid. So you're still taking rancid things, even if you get one of the good ones. So if you get ones that were just made that day and you put them straight in the fridge, that should last you longer. But I can't say how long. But the odds of you actually getting one that are good are pretty low. So vegans, they're not going to get the omega 3s that you need. 20% of your brain is made out of DHA. It's important. And that little baby wasn't getting the DHA, wasn't getting all the other things as well. And so the brain didn't grow back to that 1-year-old brain that it should have been. It looked like a 40-year-old brain, which is a lot better than an 80-year-old brain, but it's still not where it should be. And you're not going to get all those nutrients. And you can supplement, but you would need to, and you need to aggressively supplement when you're on a vegan diet. Also, not least of all, because those plants that you're feeding your kid or yourself have anti-nutrients which will block out vitamin D and choline and creatine and carnitine and all these other sorts of things, because that's another way that plants defend themselves, is having these anti-nutrients. So, yeah, unfortunately, it's very difficult to get these essential nutrients on a truly vegan diet. Certainly, you have to supplement heavily, and even then, it's very difficult. And it's really important to remember too that the reference ranges are just averages for the community, and this is why we think of B12 as just being deficient below 150, and yet below 500, or in American terms 650, below that is such a profound deficiency that people are getting brain damage, right? So that is not okay, and so the majority of that reference range is actually horrific, is actually way too low, and so that's what everybody's running off of, because these are just averages. And so every lab in your town will have different reference ranges, just like every lab on Earth will have different reference ranges for most things. Some things are agreed upon with the level of blood sugar or HbA1c that needs to be diabetic. What do we agree on that cholesterol should be under, which I disagree with, but the different labs will say, yeah, below this is where you want to be. Other things are a bit of a crapshoot. They're just sort of the average for the community, and every few years, they renorm those averages, and so the first few thousand people that walk in the door, that becomes the average. Problem with that is that most people are sick now. Most people are
Mhm.
sick, they're malnourished, they're overweight, they're hormonally depressed. Most people now have half or less than half the testosterone levels of their grandfathers at the same age. And so we're looking at this average and everybody's falling in that average. Oh, you're fine. You have all these symptoms of low testosterone, low B12, low vitamin D, and low iron, but you're like, no, 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 you're in the range. That's fine. But you're completely symptomatic because you're actually deficient, because everybody's deficient. So because you're taking the average of a deficient population, now no one's deficient. It doesn't show up. And so you talk to vegans, they say, my B12 is great. My doctor says it's fine. And in my head, I'm like, I bet you it's not. I bet you it's below 500, and I bet you're actually getting brain shrinkage. And it might be 300, it might be 200. You're fine. You know, no, it's not fine. It's not fine at all. B12 for picomoles per liter should be between 800 and 1200. That's coming from studies that have actually looked at optimal reference ranges. In American terms, picograms per milliliter, that's 1100 to 1600. Most reference ranges don't even make it up into that. And so for B12, typically, if you're not above their reference range, you might actually be deficient. And so that's important to know about. And you might actually be so deficient that you're actually getting brain damage. And so when vegans go in, they're looking at the average population that is sick and malnourished. And if you consider that 80% of the calories consumed in America and Australia and Europe and other Western countries, 80% is of the calories actually come from plants. And most of those are carbohydrates. A lot of it can be processed carbohydrates, processed foods. But either way, it's plants. And plants don't have B12 or any of those other nutrients that we mentioned, and a lot more. And so we're looking at a vegetarian population because the definition of a hyper carnivore is any animal that consumes over 70% of its calories from meat or animal products. And so Americans and other Westerners are consuming over 80% of their calories from plants. That makes them hyper vegetarians. And so you say, oh, this Western diet is all full of meat. No, it's a vegetarian diet. That is a hyper vegetarian diet. And therein lies the problem. And so we're looking at the average of a sick, malnourished, overweight, chronically ill vegetarian population. And we're trying to say, yeah, your B12 is fine. That's a problem because it's not fine just because it's average. And so most people don't even realize how deficient they are in these nutrients. And vegans especially. So they get hit twice and they think they're doing the right thing for themselves. They think they're doing the right thing for their child. And they could be extremely malnourished and damaging that child's development, which is really sad because I don't begrudge vegans from their point of view and their intentions. I think they have quite good intentions largely, that they're trying to be healthy, they're trying to be nice to animals, and they're trying to do the right thing for their kid, and they've just been tricked and convinced that a vegetarian, a vegan diet is the optimal diet for human beings. Like we're herbivores all of a sudden after being apex predators for 2.5 million years. All of a sudden we just switched and now we're herbivores. That doesn't make any sense. But they've had their good intentions co-opted and it's hurting them. And so I actually have really strong feelings over this because I've seen so many people hurt. 60-70% of the people that follow me on social media and do carnivore came from a plant-based diet, a vegetarian or vegan diet, and they had to switch because they were getting such severe health issues. And so it really makes me sad because they're doing this for the best of intentions. These are good people that I become friends with, a lot of them, and they're good people. I don't care that they were vegan. I don't care if you are vegan. If that's what you're doing and you're choosing to do that, then that's great. But if you're trying to be as healthy as you can and you're trying to get your kids as healthy as they can be, then that's not the way. And you're getting hurt, and unfortunately, you're hurting your kids, which no one wants to do. And so, yeah, and so regardless of your ideology, if you know that you're not getting enough nutrition for you, that's your choice. But your kids deserve better, and your kids need these animal source nutrients. And I'm sorry, but the the health of your child is paramount, and it supersedes any concern you have over ethical treatment of animals. It just does, because you cannot satisfy their basic nutrition from supplements as of yet, and you will bring in anti-nutrients and have other problems, and that's not fair. That's not correct. And so I really hope that more people look into that, because you don't want to end up with that brain on the left, they're looking like an 80-year-old brain at 6 months old.
Yeah. I really love that you brought all that up because there's a saying that fed is best. And with what you've
Mhm.
just brought up, it seems that babies that are actually fed formula may be better off than babies that are from vegan, vegetarian parents.
Yeah, in that regard, it could be, because at least they're getting. I mean, the problem is with that is there's a ton of sugar and there's seed oils and there's a lot of garbage in formula, but it looks like they're probably trying to get that restriction. Right now, it's by law, you have to have seed oils in baby formula by law. And that's insane. So much linoleic acid that's actually neurotoxic and causes neuroinflammation. So not what you want. And so what you really want is better design formulas and things like that. But yeah, but at least they would at least have those nutrients, the nutrients that your baby needs. Maybe it has sugar and seed oils, which you don't want, but at least it has those nutrients that they need, and at least they'll survive and at least have better brain development. The problem with kids that have been raised on vegan vegetarian diets is that there's more and more studies coming out now. They are shorter, they have worse bone density, they are more sickly, they have more sick days of school. So they're weaker. They have, yeah, they don't develop properly. And so this is not providing them with adequate nutrition. And that's, that doesn't matter how good your vegan diet is. I mean, yes, of course, there are obviously relative versions of this, just like there's relative version of carnivore. You do a low fat carnivore diet, you'll get protein poisoning, you'll get sick, lose your hair, lose excessive amounts of weight, and become very sick. You could even die. Vegan diets, if you're eating a whole bunch of Oreo cookies, sodas, beers, and fries and things like that, and just sitting on the couch and smoking cigarettes and drinking alcohol, all things vegan, shooting heroin, still vegan, and not taking supplements, you're gonna really suffer. Your health is going to suffer, and people have died. People, these fruitarians and things like that. I mean, some of these guys are start dropping off, and they look extremely anorexic, extremely sick, but they only show the pictures of them when they were, 22 and cute and just started doing a fruitarian diet. They don't show them when they're in their 30s, right before they died, where they look shockingly sick, and they look like they're 70 years old at 32. They don't show those sorts of things. Um, but if you're eating a vegan diet and you're making sure you're taking all these supplements and all these this and all these that or whatever to at least try to cover your bases, and you're cooking and fermenting and processing these plants in the ways that we've been doing for thousands of years to lower their toxicity and lower their anti-nutrient effect and increase the bioavailability, then sure, that's a better way of doing that. But if you're not getting your basic nutrient demands, you will get sick and eventually you will die. And that's really sad. And people are doing this for the best of intentions, but they're suffering as a result. And that's not okay.
Yeah, I agree. It seems like the whole diet heart hypothesis back in whatever it was
Mm,
with Ansel Keys and such is far more insidious than, like,
yeah.
we make out. Like, it seems planned to me, but I don't wanna go the whole conspiracy route, but ultimately, it's very important that we get these saturated fats in order to actually feel vital and be robust human beings.
Mhm.
Moving on to type 1 diabetes, because this has kinda confused me,
Mhm.
with ketoacidosis and such. I've never really been around too many people that are type 1 diabetic.
Mhm.
So, what are the differences between type 1 diabetics and type 2 diabetics, and how does that
Mhm.
impact how they could approach carnivore?
So type 1 diabetes used to be called juvenile diabetes because it typically showed up in youth. And then type 2 diabetes was usually um, adult onset diabetes. Usually was thought that this was more lifestyle issues. People that drank alcohol were more predisposed to getting type 2 diabetes, adult onset diabetes. Type 1 diabetes is thought to be an autoimmune issue, that this sort of, some sort of attack on your pancreas, on the beta islet cells that produce insulin, and that you lose the ability to make insulin. You have looked at different antibodies that seem to be specific for those cells, and they damage the beta islet cells. Interestingly enough, the stem cells don't get damaged, and so you still have beta islet stem cells. And so potentially, if you can stimulate those, and you could potentially regrow the beta cells. And we actually see that in animal studies when they put them on ketogenic diets for periods of time, they actually can regrow those beta islet cells. Now, the difference between those animal studies and humans is that they're not getting this from an autoimmune attack or some sort of inflammatory damage or viral damage or whatever. There's a lot of theories, but what they damage the beta cells themselves, and then all of a sudden they can stimulate their regrowth. So if you still have that active damage that's happening, say from antibodies, then even if your stem cells are actually regrowing beta cells, they're going to be killed off pretty much immediately before they can make immune cells. So you have to be able to treat this like, well, you treat it like an autoimmune issue generally, which in the carnivore world, you just put them on beef and water. And I have a whole lecture on rethinking autoimmune disease and the real cause of autoimmune disease, looking at this and actually arguing that this is actually not an autoimmune condition. It's actually lectins and plant toxins that are attacking your body, and then your body attacks those lectins, and your changing something on those cells, so now they attack those cells. But once and your cells get damaged in the crossfire. Once those lectins are away, just like in celiac disease, celiac is considered an autoimmune condition, but it's also called a gluten-mediated autoimmune disease because gluten is a lectin. And these lectins are proteins with a carbohydrate substructure, and they bind to all sorts of different things on our cells, and they cause it glutination. So your villi in the stomach, in your gut, where they absorb a lot of increase the surface area, so you can absorb a lot more nutrients. They'll stick them together, and they'll agglutinate. They'll make them stick together. So lectins are agglutinins, meaning they stick to cells. They make all those cells clump together, and that can elicit an immune response, and then that can damage those cells even further. But when you remove the gluten, you remove those lectins, the damage stops and your body stops attacking that area. And after 4 to 6 weeks, the gut is completely healed. Even though the antibodies can stay elevated for celiac antibodies can stay elevated for over 3 years after your last exposure to gluten. And those antibodies go slowly down, slowly down, slowly down, like it would with any sort of pathogen that it's not seen in a while. Slowly start coming down. Then they see that pathogen again, bam, it's up again. And then slowly down again. That's what it does with gluten. So no gluten is just slowly down, slowly down. Maybe 2 years later, all of a sudden you eat some gluten and bam, they're back up again. And you get all this damage. But even then, after you stop eating the gluten, even though those antibodies are elevated, you're not getting any damage. And so that's not an autoimmune condition. Your body is not attacking itself because your body is still there. And yet it doesn't attack itself. Okay. So it's actually attacking the lectins, or the lectins are doing something to them to cause that attack. And I think that's what's happening with all other autoimmune conditions. That has not I'm not the only one who thought of that. I mean, I was thinking that, but then I've found other people that actually published on this. Dr. Freed, Freed, in 1991, he published a paper arguing that all these autoimmune conditions could not be explained by the body attacking itself, but they could all be explained by the known effects of plant lectins and what we know that they do in the body. And when people remove plants and just eat red meat and water, and you remove all those lectins, autoimmunity starts shutting down. And this is actually the treatment for autoimmune disease since the 1800s with Dr. J.H. Salisbury, who put people on just beef and water diets and found they could reverse autoimmune conditions like rheumatoid arthritis, Crohn's, ulcerative colitis, and so on. And we're seeing this today as well. And throughout the 20th century, a lot of people did this actually. It just didn't have huge market appeal because it doesn't cost anything. There's no product behind it, and there are multi-billion-dollar drugs that treat these things too. So it gets all just quieted up because we don't have a multi-million-dollar marketing budget to get this on every single news station and have reps go out to hospitals saying, "Hey, all you got to do is just stop eating plants, and all your autoimmunity will go away in your patients." There's no money behind that, so there's no marketing budget. Um, but when you do that with type 1 diabetes, and I've seen this a few times, there's 2 published case reports where people have actually reversed type 1 diabetes with a carnivore diet. Um, it wa in those case reports, they basically showed that they just put on just meat and water, and the antibodies started coming down, insulin started going up, natural insulin started going up, C-peptides started going up, and that's a marker of your own endogenous insulin production, so your own body making the insulin. And so, you actually could see it, and now they're getting normal blood sugars. They weren't requiring insulin. Their HbA1c was nice and low, and their blood sugar was nice and low, so they didn't require any further insulin outside of the body. And so this was actually effectively reversed the type 1 diabetes. I since spoke to the authors of those studies, and they said that they've actually seen this a lot, and that when you get to people with type 1 diabetes within the first year, you actually can improve the insulin production quite dramatically, and sometimes come off insulin completely. And sometimes not. Sometimes you have to still use a bit of insulin, but it's a lot less because you're not eating carbohydrates, so your insulin demand is much lower. But some of these people were able to stay off insulin. It's been 15 years now that they've been doing this. And they've had one patient that had been type 1 diabetic for actually 15 years that was able to come off insulin completely. And likely that's something that stimulated those stem cells and were able to regrow the beta islet cells. But because there was no lectins in the body and they weren't precipitating this immune action, they didn't kill off those beta cells straight away. So they had to stay on the diet though, which would make sense if the plants, et cetera, were the one things, or the lectins, et cetera, were causing the damage, because obviously, just like in celiac, you bring those problems back in, you're going to bring back the damage. And your gut heals very easily. The pancreas does not, and especially the beta islet cells. And so, um, one of those girls in the case report actually started eating just normally again, and sure enough, just destroyed her ability to make insulin, and that she was into insulin dependent after that. But the author of that study, or both of those papers, actually said that they have dozens of other patients that were able to come off insulin and stay off insulin and have not had to return back on. So that's great, and I've now done that twice. I've had 2 patients that have done that. We caught them very early, really right after they were out of the hospital, and they had diabetic ketoacidosis, they had polydipsia, polyuria, they couldn't drink enough, they were peeing constantly, they, lost, 30 pounds in a few days. They were very sick, and so they had positive antibodies, they had no C-peptide, they had no insulin, so this was a barn door diagnosis of, type 1 diabetes. And one young woman, her husband brought her in to see me, a week or so after she was out of the hospital, and her insulin and blood sugar were all over the place, and it was very difficult to control. Just eating normal things. We got her to go onto a ketogenic carnivore diet, and things settled down. And now this was very even, right? So she still required insulin, but it was much less, and it was much more even. She didn't have these spikes and ups and downs and things like that. It was much more steady and able to be controlled. And so she did really well, and her husband helped her with it and helped her stay on track. And after 6 weeks, we checked her C-peptide, and actually it was there. It was still below the reference range, but it was there. It was before, it was not. So C-peptide is a marker of your own native insulin production. And so our bodies started making insulin again. And then she kept going, was going very, very well. And then 6 weeks after that, so 3 months down the track after we started all this, she actually had normal C-peptide and optimal insulin and optimal C-peptide for that matter. And she was on no exogenous injectable insulin, none. And her blood sugar was perfect. Her HbA1c was 4.5, which is ideal for a non-diabetic, right? So, and I've seen that twice. I've had 2 patients do that. My other patient was a male, and he sort of worked away and traveled a lot for work, couldn't quite keep up with the diet, had reversed all these things, same thing. Off insulin, HbA1c was perfect, C-peptide's perfect. And then he sort of was off the diet, and then he started needing insulin again and all that sort of stuff. And then he said, "Okay, look, I can't do this. I'm not gonna live like that. I'm just gonna make this happen." And he made the carnivore diet work. 3 months later, he's off all his insulin again, HbA1c, mid fours again, and extremely healthy and doing well. So, I've seen it, and type 1 diabetes is an autoimmune condition at the end of the day, and autoimmune conditions do improve dramatically from a carnivore diet. Now, it can stop the damage, but if the damage is done, you've completely destroyed your beta cells and stem cells aren't making new ones, or you don't have enough to really, pick up the slack, or you have Hashimoto's and your thyroid is completely destroyed, you know, there's damage done, and we won't necessarily be able to recover from that, but it will stop further damage from happening and allow your body to heal what it is capable of healing. So, sorry, that was a long, long answer that went on some tangents, but type 2 diabetes is really lifestyle related. It's really, you can think about it as carbohydrate poisoning. There's other sorts of things as well, but it's not a disease per se. It is toxic exposure. You're chronically exposing yourself to different sorts of things that can cause elevated blood sugar, cause insulin resistance, cause excessive glycation from elevated blood sugar, and you start getting damage, and you can't control and regulate your blood sugar properly. And then that excessive blood sugar causes glycation, which is when those sugar molecules physically fuse to other molecules, permanently damaging them and make advanced glycation end products, AGEs. These are different to things like AGEs if you consume them, because it's not just total burden of AGEs in your body. It's the AGEs that are formed from your body that glucose attacks your body and damages the molecules that your body is trying to work on. That's building up damage in your body. But that damages your blood vessels, and that can damage the blood supply to different organs and cause kidney failure, cause blindness, cause decay, infections, and then amputations in your feet. So number one cause of kidney failure is high blood sugar, diabetes. Number one cause of adult onset blindness is high blood sugar, diabetes. The number one cause of getting your leg amputated is high blood sugar, diabetes. And so, number one cause of cardiovascular disease, heart disease, high blood sugar, diabetes. You're damaging these arteries. You're damaging the blood vessels. You damage the blood vessels to your nerves. And now you get peripheral neuropathy. You get numbness and tingling. And it damages your brain. Alzheimer's is now being called type 3 diabetes. PCOS, polycystic ovarian syndrome, is being called type 4 diabetes. These are all a consequence of eating the wrong thing. And so you cut out all of those things. You just eat fatty meat and water in a ketogenic fashion. And actually, that all reverses. And we actually see that in clinical trials. Fun fact, the only treatment and the best treatment for treating both type 1 and type 2 diabetes for 150 years, from the late 1700s to 1921 when we discovered insulin, was a ketogenic meat-based diet, where predominantly meat and animal fat, cut out all carbs, and had essentially equal grams of protein and fats. That was the treatment. I have a textbook from Sir William Osler, who was the first professor of medicine at Johns Hopkins in the late 1800s, and he was knighted for his work in medicine and medical education. He's considered the greatest medical educator in history. And I have his textbook from 1910, and there's a chapter on diabetes, and it says explicitly the treatment, the gold standard Johns Hopkins treatment for treating diabetes, type 1 and type 2, was animal-based ketogenic diet. You cut out carbs, you eat protein and fat, and in basically equal proportions. You get that from meat. You cut out everything else. And that was the only thing that was keeping people alive. That was the only thing that keeping type 1 diabetics alive. And they were doing it without insulin. So they're able to survive without insulin. That's amazing. And maybe some of these people were doing this similar thing. They weren't fully carnivore, only eating meat. So maybe they were having some veggies and this, that, and the other that maybe kept that lectin count up and kept that damage coming, but it slowed it down significantly and lowered their demand for insulin because they weren't eating carbohydrates. And so maybe they couldn't fully reverse this. However, this was letting them live 7-9 months longer than they would otherwise, because you just die when you get that sort of diagnosis now without insulin. This was allowing them to live 7 to 9 months. And Osler said that, yeah, there's a very high mortality rate, especially in the younger patients, the juvenile diabetes patients, the type 1 diabetic patients. But listen to the wording. It says it's a high mortality rate. It's not a death sentence. It's not an absolute mortality rate. It's not 100% of these people are going to die. Some of them were living. Some of them were surviving. That's in the medical textbooks from 1910 from Sir William Osler, one of the best medical educators in the world. And so what does that mean? Some of these people were actually putting that type 1 diabetes into remission. And remember, this is 11 years before insulin was invented and discovered, right? So these people were living and surviving with type 1 diabetes without insulin by just eating an animal-based diet. Now, maybe those are the ones who just ate meat. I don't know. It doesn't say in the book. But either way, people were surviving, and they were living long-term without insulin. And so that's really important to understand. And now people are sort of getting back to that and rediscovering that, and all of a sudden say, hey, why did we throw this away? When insulin came in, they just said everything's about insulin. Great. We fixed it. We solved it. Type 1 and type 2 diabetics, they just got insulin. Get that blood sugar down. And then people started dying too, because they were getting hypoglycemic and they're dropping into comas and dying. And so that was a problem. And this is another interesting thing. This is proof number 2 that humans are not designed to eat carbohydrates. We have the wrong kind of insulin for carbohydrates. We don't make insulin for carbohydrates. We make insulin for protein. So the insulin that we discovered was insulin, our insulin. But that wasn't working properly, because when people are eating carbohydrates, they'd get this big blood sugar spike. You give them a dose of insulin, blood sugar would go down. Now it would go too low because insulin just stayed up and up and up and up and up. Now they're getting hypoglycemic, and now they're getting sick. They're going to comas. They were dying. And so they had to give them sugar. They had to give them carbs. They had to keep feeding the beast, right? Type 1 diabetics go, now, whoa, no, I have to eat carbs. I couldn't do a ketogenic diet, even though people are, because I take insulin and I have to have carbohydrates if I have insulin. No. You had the insulin because you make carbohydrates. not the other way around. You don't need to say, oh, what? It's not like a bodybuilder like Dorian Yates who discovered that if you inject massive amounts of insulin, you could get massive muscle bulk, but you have to eat like 400 or 500 grams of carbs a day so you don't die from taking that much insulin. So he had to eat carbs because he was taking so much insulin. But type 1 diabetics need to take insulin because their bodies are making carbs. It's a big difference, and or they need some insulin anyway, right? But you don't need to feed yourself a whole bunch of carbs. But now they did because you get this insulin bump, or you inject this insulin, it goes up, and then your carb spikes, and then it goes down in the gutter, and you fall into a coma, and people can die. So they have to eat more carbs, and get out of this hypo and all that sort of stuff. I think we still do that today. But what they did, which was very clever, but people should have thought about this at the time, they had to reinvent insulin. So now you have these fast-acting insulins like Act Rapid, Nova Rapid that better match that carbohydrate spike. So carbohydrate blood sugars go bam, and then Act Rapid bam, and then both go down. And so you end up with normal blood sugar at the end of it, as opposed to hypoglycemia, comas, and death. So now type 1 diabetics who have actually gone to ketogenic diets, carnivore diets, now the blood sugar control is much more stable. They don't need nearly as much insulin. But now they're finding that the Act Rapid, the Nova Rapid, is too sharp of a spike. And they're eating protein, they're eating fat. Fat doesn't require insulin, it doesn't raise insulin. And it's the only macro that doesn't raise insulin. And so protein will require a bit of insulin, but it's a much more gradual bump, right? As opposed to carb, bam, bam, right? And so you're using this Act Rapid, goes bam, bam. And so now you're dropping sort of too low, but then it starts creeping up and going up and up and up because you're having protein. The protein's still there and it's still going. So it doesn't match that curve properly. As you have to take like a little bit and a little bit and a little bit and a little bit, instead of doing calculus and discovering the area under the curve, you're using triangles and boxes to try to estimate it with algebra, right? So it's not as elegant. And so what they found is that, which is very clever, is a Dr. Bernstein that figured this out. He's recently passed away, but he's a bright guy. He figured this out. He did a lot of good work for the type 1 community. He found that the original normal insulin that we would normally make, that we first discovered in 1920s, that actually perfectly matches that protein curve. As you go back to normal ass insulin, and you have your protein meal, and you just take normal insulin, that matches that protein curve. So our insulin is designed for protein. It's not designed for carbohydrates. Our bodies are not designed for carbohydrates. We have the wrong insulin. We have, we rot our teeth. We have carbs produce the bacteria that rot our teeth. And no animal will rot their teeth on their natural diet. So those are two proofs that we are absolutely not designed for carbohydrates, and they cause harm. And there's a lot more harm that they cause too.
I like the way that you put that, like, people, they're almost feeding, like, an insulin addiction at a certain point where it's like, if
Mhm.
it spikes up too high, then, yeah, you're eating the carbs in order to kind of just get back to baseline, otherwise you're gonna go hypoglycemic and into a
Mhm.
coma.
Yeah.
So what is ketoacidosis? How does that happen?
That's from a lack of insulin completely, and you're eating carbohydrates, right? Because
Okay.
you typically don't go into keto. Well, at least according to Osler, you weren't getting that ketoacidosis um, when you were going on that. Maybe someone came in with ketoacidosis and they just fast them and stop them eating and all that sort of stuff, and that sort of settles down and everything sort of settles down. Diabetic ketoacidosis is, and this is what people get freaked out with ketosis. They confuse ketosis for ketoacidosis. They're not the same thing. In fact, calling the metabolic state that we're in um, when we're burning fat ketosis, I think is sort of misnamed. It's not describing the metabolism as well as you could. Um, it's just a fat burning metabolism. You're just in a fat burning metabolism, and when you burn fat and use it for energy, there's ketones there. Okay, so that's just normal fat burning metabolism. Diabetic ketoacidosis is you have zero insulin, and so your body can't use any of the glucose that you're eating or even that you're making, and as a result, your tissues have to have ketones, your ketones go up, but also insulin blocks lipolysis and slows down that process. Now you have zero insulin. So now there's a lot of lipolysis and you're just flooding out fat. So your ketones go up. But it goes with acidosis. So you become acidotic, your blood pH goes low, and then there's various reasons for that. But the acidosis is what is hurting you. The acidosis is what is killing people. It's not the ketones, and the ketones themselves aren't specifically causing that. So it's a very different state. But that's what people would get with type 1 diabetes. You typically don't get that with type 2 diabetes. Ostensibly, you could get something similar if you were an insulin-dependent type 2 diabetic and you burnt out your pancreas and you just make no uh, insulin anymore. And then so if you're not injecting your insulin, then potentially you could do that. But typically, type 2 diabetics would not go into diabetic ketoacidosis because they have insulin, and that's the key driving factor is the lack of insulin. But again, if you are on ketogenic diets, like Osler discussed, then you typically don't get that ketoacidosis.
So it ultimately happens because of carbohydrates, not because someone is consuming protein and fat. And it seems
Yeah.
like, okay, PCOS, but since you mentioned it, is type 4 diabetes. We're
Mhm.
going to need a whole lot of different types of diabetes. And
Mm.
hopefully people start to wake up to the fact it's like there's one common denominator among all of
Yeah.
these.
Yeah. Yeah. Exactly. Well, you know, in medical school, you sort of teach that way. You basically put everything in the context of diabetes, and you sort of relate all these different diseases. And all this is like diabetes of this, and diabetes of that, and then this, that, and the other. And so, and what is this like with diabetes? Everything's about diabetes, and sort of teaching that way, which I don't, which is a bit of a weird way of teaching it, but it's sort of funny you mentioned that because they do sort of teach things, and then so maybe you should put that together. Like, well, hey, maybe these things are all related. Maybe these things
Mhm.
have something to do with each other. Um, PCOS, polycystic ovarian syndrome, is the number one cause of female infertility worldwide, and it is really easy to fix. Fertility clinics have already figured this out, but they only got halfway there because they look at this and they say, "Oh, okay, you have PCOS, you have high insulin, you have high blood sugar, and that's blocking the conversion of testosterone into estrogen. We make testosterone first, and that's converted into estrogen in the ovaries. Insulin blocks that. So we know this. This is in physiology textbooks. So what do they do? You have too high testosterone, not enough estrogen. You have PCOS. There's other ways of looking at it, diagnosing that as well. And what happens? Okay, you put them on diabetes medication. You put them on metformin, and that lowers blood sugar, lowers insulin, and all of a sudden you're converting testosterone into estrogen properly. So now you're having normal testosterone, normal estrogen. You can get pregnant, or you just stop eating carbs. Your insulin just comes down anyway, right? And then you get pregnant as well. And so I've even been calling cancer type 5 diabetes because cancer, as it turns out, is not a genetic disorder. It's a mitochondrial disorder. Different cancers have some of these things have genetic changes, but in the same tumor, they could have different genetic changes in different cells, and some would have no genetic changes. Some entire cancers have no genetic changes whatsoever. Every single known cancer has damaged mitochondria. Mitochondria are they run the cell. They're also the policemen for the cell. So if a cell wants to divide, the mitochondria say yes or no. And if the mitochondria are damaged and they can't say no, it's an active process. So that cell will just divide unless the mitochondria shut it down. And if that cell is too broken and too damaged, the mitochondria are who kill it. And so if your cell's saying, "Oh, hey, we need to die, we need to die, we need to die, you need to do it," if your mitochondria are dead, it's falling on deaf ears. And so it doesn't kill itself. It can't apoptose. It can't shut itself down, and it continues to divide. And so those are hallmarks of cancers, which is that they don't shut themselves off, and they have unregulated cell growth. So they just keep proliferating, and you can do that without damaged DNA. But every single one has damaged mitochondria, and mitochondria require, um, oh, sorry, and mitochondria are able to process carbs or ketones for energy. If you have damaged mitochondria, you can't process ketones. This is why red blood cells require glucose because they don't have mitochondria, so they can't process ketones. So they still need glucose. This is why we have glucose because some cell lines still need glucose. So red blood cells, some of your, the medulla of your kidney, a few of your areas of the brain, things like that. Majority of it can run on ketones. cancers can't run on ketones because they don't have mitochondria. And so they require glucose, but they have far more insulin receptors, and they have a bigger demand. They need about 400 times the amount of glucose as other cells because they have a higher metabolic demand, and it's more less efficient for them to make energy from glucose and glutamine without mitochondria. And so they suck in an inordinate amount of glucose because they have far more insulin receptors. So they take a disproportionate amount of glucose in because they need it. And so you go ketogenic, and that actually slows that down. You actually are limiting the amount of energy available to those cancer cells, and it may not be able to meet its metabolic demands, and they can actually start to just die off. Also, when you eat sugar, there's a study that showed that sugar of different kinds, you give somebody 100 grams of sugar, and it actually shuts down their cellular immune defense. So it shuts down the neutrophils. They can't phagocytose other cells. They can't attack bacteria and other cells and kill them and eat them for up to 5 hours after you've eaten your sugar. And you're eating sugar all day. You're feeding this cancer and you're shutting down your immune system. That's a recipe for disaster. And so the reason I call it type 5 diabetes, and so there's ketogenic metabolic therapy. People are using ketogenic diets to treat cancers now, and we're getting more and more studies out there, which again don't have money backing them because there's no product at the end of it. So these are all independent grants that have to be gotten, and then there's no marketing after the fact. There's not getting on the news and things like that. Hey, look at this, a new advancement in cancer, because there's no product, so they're not pushing this from a product placement point of view. But the reason I call it type 5 diabetes is because of the mitochondria. And normally, when you damage your mitochondria past a certain extent, your cells can't function anymore and you get cancer. Um, if you had low insulin, you probably wouldn't have gone there. Now, you can have a lot of things that damage the mitochondria. Seed oils, increase your risk of developing cancers and things like that. And a lot of them can. They used to give mice corn oil in the 60s to give them cancer so they could study the cancer. And it also dampens the immune system. They were giving people with organ transplants seed oils in the 70s, and they didn't reject their organs, things like that. They gave hairless mice, seed oils or saturated fat, butter, tallow, things like that, and exposed them to UV light. Only the mice with they were eating the seed oils were getting skin cancer. The other mice were not getting skin cancer. And then they started feeding the mice that weren't getting skin, who were normally getting butter and tallow, started giving them seed oils. Bam, skin cancer. So this could very well be damaging those mitochondria, and other plant toxins that we call carcinogenic. They work by damaging the mitochondria, but your body has a natural ability to repair your cells and repair your mitochondria. It's called autophagy. And this is probably something you know about, and a lot of people listening know about it. It's becoming more of a buzzword. They say, well, you got to fast for 5 days every 3 months, like Dr. Peter Attia recommends, in order to kick off autophagy and sort of eat up these old precancerous cells and improve your mitochondrial function and things like that. But the thing is, if you're just in a ketogenic diet and you're in a ketogenic state and you keep your insulin low, you're going to be going through autophagy all the time. And part of autophagy is not just replacing the cell, but you can replace some of the constituent parts inside called the organelles, like mitochondria. So you get mitophagy and mitogenesis. You're increasing the number that that you have, and so that just comes from low insulin because elevated insulin actually blocks autophagy. So you shut down that normal process. So studies have shown that on a ketogenic diet, without long periods of fasting, just on a zero carb diet, that you will actually go through autophagy. And after 3 months, that you will have 4 times the number of mitochondria, and they're 4 times as effective because you've broken down all these old damaged slow ones and you replace them with new faster ones, and you've quadrupled them. So you've massively increased the efficacy of your mitochondria. And if you're constantly replenishing your mitochondria from mitophagy and mitogenesis, it's really hard to overwhelm that system and to give yourself such a damaged mitochondria that you get cancer. And so that's why I call cancer type 5 diabetes, because if you kept your insulin low, you would constantly be going through mitophagy, and you would constantly be replenishing mitochondria, and it would be extremely difficult for you to actually get cancer.
Insulin, for those that don't know, is the master hormone, and it influences pretty much all other hormones, so testosterone, estrogen, growth hormone, um,
Mhm.
and insulin overall just helps things grow, no?
Mhm.
So people that are type 2 diabetic, type 1 diabetics, they may struggle to lose weight. That's probably one of their goals. Wouldn't injecting insulin cause them to actually put on more weight? It's a fat storing hormone.
Yeah, that's exactly right, and, that was actually the plan previously because, kids with type 1 diabetes, it's called failure to thrive. They would just get so skinny because they couldn't put on fat, and, they would get they looked, emaciated and unwell, and then eventually they died, for some of them, many of them in many cases, but then when they gave them insulin, you see these before and after pictures where someone's just, really skinny and frail, and then all of a sudden they're just this nice, normal, happy, fleshed out kid. And yeah, so you need insulin. It is really important. And Dorian Yates found out that it's a really good anabolic steroid. You pump in a bunch of this stuff, and you eat a ton of carbs so you don't die. On top of all the steroids, on top of the growth hormone, on top of all the things that they were doing before, this just puts you into the next level. And so he was, one of the first, really one of the first mass monsters that just huge, and that was from insulin. And so, yeah, if you do take insulin, you can put on fat, and so this is part of the reason why they say, well, you need to when you're gaining muscle, you have to gain fat. Well, that's only if you're using carbs and insulin. When you're in a ketogenic state, a carnivore state, you can put on plenty of muscle, uh, tons of muscle, and and you will get insulin bumps from eating protein. You're eating a lot of protein, you're going to get more insulin, and you're going to build muscles. You look at some of the best physiques in history, the golden era bodybuilders, Serge Nubret, Arnold Schwarzenegger, Sergio Livra, um, and Vince Caranda. These guys were insane specimens. This was before they even had growth hormone, and they didn't know about insulin yet. They had some steroids. Vince Caranda was outspoken against steroids. He thought they just gave dumb looking muscles. That there's like those aren't aesthetic. Those aren't actually that's not actually a normal looking body. And so he was very much against steroids for that reason. And they just ate steak and eggs, steak and eggs, steak and eggs, steak and eggs. And in fact, Vince had this special shake where he'd do 30 raw fertilized eggs a day, and you maybe put some heavy cream in there, and you just blend it up and drink it down. And so it's 30 a day, and you do a sort of shake with 10, 10, 10 in it. And then you'd eat a whole bunch of meat and eggs and things like that as well. And these guys were getting absolutely shredded and jacked. Look up Serge Nubret. Have you come across him before?
No, not him in particular, but I have been watching your
He's
videos with Dr. Nash Jokic, I think it
Yeah,
was.
yeah, yeah,
Yeah,
yeah.
really interesting.
Serge is absolutely jacked, and he was Arnold Schwarzenegger's body idol. And so he was like a five-time Mr. Olympia, just an absolute unit. And and he would eat 6 pounds of horse meat a day, right? And so, it was, and then, you might have a bit of carbs or things like that on the off season, but typically, he just ate pretty much meat every day, and that's what kept him lean and muscular all year round. And for 3 months leading up to, the show, it was nothing except meat and water, and that's it. And he had one of the most insane physiques. If you want, I can share. I can pop up a
Sure,
picture of him. You want to see it?
before
Okay.
I think I've seen the picture, but for the audience too.
So yeah. So look at this beast. And
Yeah,
this was like you might have used some
natural.
PED, but they were yeah, yeah, pretty close. I mean, he wasn't. I don't think he was sort of 10 years older than Arnold, so he was sort of a bit before steroids really started taking hold. And so I don't know if he used a bit or not, but he was a unit and a beast. And you see him next to Arnold, and I mean, he was just absolutely phenomenal. I mean, look at this dude, you know. And he maintained that for well into his 60s and 70s, and he ended up dying prematurely, saying that he thought he was poisoned or something like that, made some post that he was being poisoned or something like that. Well, which is, hopefully he wasn't, but anyway, absolute massive unit, and he was just eating meat, and he was attaining that physique with just eating meat, and he didn't even like eggs, so he didn't even eat eggs, and he didn't like fish, so he didn't eat fish. He just liked meat, and he just he just ate a ton of meat every single day,
Yeah.
and that's all you need. That's all you need. I've never put on muscle more easily than when on a carnivore diet. When I've been on just a normal the diet I've been raised on, which is what everyone's saying, "Oh, you should add back in carbs and all that sort of stuff," and they're saying you should eat 65% carbs of just whole grains and, good things and not junk food or whatever, or maybe they're eating juice and sugar and things like that if they're really batty, and then lean meat and some veggies and things like that. That's what I grew up on. That's why my parents raised us on because that was thought to be the best diet for decades, and that's what got people in these problems. That's what gave my mom type 2 diabetes at 45, was that exact diet. People go, "Oh, you can cure diabetes by doing this." No, you can't, because it gave my mom diabetes, and it gave a lot of my patients diabetes. I've had a lot of patients come from that exact diet who have gotten very sick as a result of it, and so, no, that's that's not really what we're seeing, and I would put on weight um, if I wasn't in season for a sport or something like that. I'd start, getting a bit fluffy around the edges. I'd lose my six pack and things like that, and then I have to work to get all that back, and, if I'm working out constantly, then sure, that's fine, but if I even took a couple weeks off, I'd start seeing, things start creeping up and start getting a bit softer around the middle, as a kid, as a teenager, and then certainly as an adult. And then I went full carnivore and I just ate a lot of fatty meat. Never had that problem. I'm never more than 10% body fat, even if I'm not working out. 3 months not working out, 6 months, a year, it has happened. And yet I'm never over 10% body fat, and often less than that. Um, so that's just complete that's just diet. That's all diet.
Mm.
And so you can absolutely keep that up, and your body is great. You can stimulate massive amounts of muscle. If you wanna go for the, Mr. Universe and Mr. Olympia and things like that, I think Serge was five-time Mr. Universe. Yeah, I forget which one. Anyway, so he was, but, if you're going for something like that and you have to compete against these mass monsters and things like that, you're not doing the natural competition, that's on you. There are ways of gaming the system, but you certainly don't need to. And if you look at a lot of these natural, Mr. Olympias and things like that, that physique is absolutely attainable on a carnivore diet, absolutely. And you would probably excel on that. I mean, you can probably get, yeah, depending on your your sort of genetics and your work ethic and your training program, you could do very, very well. Obviously, different people just have different statures and things like that and different sort of potentials, but that those are very attainable. In the natural competitions, those are very attainable physiques in the natural with the carnivore diet. And I mean, I've had physiques that, friends of mine told me, they were like, "You could walk up on a stage right now in a natural competition and do really well without trying, just playing rugby and working out." So it's definitely something that you can do. You can absolutely build massive amounts of lean muscle and health by doing this.
I agree. It's been pretty effortless for myself to stay lean. And since watching your
Nice.
videos with Dr. Nash, I've been adding a lot more
Mhm.
volume. The wifey's
Mhm.
noticing too, so that's always good. I've
Yeah.
received more
Nice.
compliments within the past 11 months than past 4
Mhm.
years. So
Yeah.
something's working, and that's what makes it easy for me to stick to this. I really don't see myself changing anytime soon. My
Mhm.
joint pain that I was dealing with some knee issues, which I've documented over a few episodes now, just vanished. My joints feel amazing. My strength's through the roof.
Nice.
I'm stronger than I was back in college. So I don't think
Mhm.
I'm going anywhere too soon. So to wrap this
Nice.
one up, I mean, you pretty much answered all my the diabetes questions anyway. But the last one I have in regards to that, you said that it had to be done soon afterwards. Like, you notice a patient after a week of diagnosis, she was able to go into remission of her type 1 diabetes. So there's a point where it's no longer salvageable and your pancreas is kinda just shot or
Yeah, well, it seems to be for a lot of people that you don't get it within the first year. That's been the experience
okay,
of the author of those case reports of those 2 patients who reversed their type 1 diabetes. So that is, that was just their experience, but again, they had one patient who was 15 years on and was able to come off all insulin. Now, even if you're past a year or past 15 years as a type 1 diabetic, it will still improve your glucose control, your blood sugar control. You'll get better control. You'll need less insulin. And if you use the natural insulin, then you'll get better matching of that protein curve. And so you'll just get better health. And so you can live with this issue much easier and healthier. And that's very important too. Um, if you do try this, if you get you or someone you know try, gets diagnosed with type 1 diabetes and tries this straight away, sooner the better, um, because there's less damage early on. And but it can take months. I mean, for both of those patients, it took a good 3 months before they really came off of insulin and we're starting to make, or just under 3 months anyway. Um, and so, it will take a bit of time, but it can improve. And at the very least, if you say nothing else, it will at least improve your control over the diabetes and your blood sugar and get more optimal blood sugar levels. You're not damaging yourself with this chronically high blood sugar and having to use so much insulin because that can hurt you too. There's studies that are showing that they say with people, oh, you don't want to keep your blood sugar down too low because that means you're getting hypos and this that, and the other. That actually comes from a study that looks at correcting blood sugar and via HbA1c and trying to aggressively treat this and aggressively get this down to normal levels. And what they found was that a lot of people were dying. They're getting heart attacks and strokes and things like that. But so they said, "Oh, okay, you don't want that. You want your HbA1c for a diabetic between sort of like 6 and 7. That's sort of the range we're looking at, even though lower than that is better for a non-diabetic. But that's because they were lowering the blood sugar with aggressive insulin injections. And so they weren't telling them, "Hey, limit the carbs so you can limit the insulin." They said, "Eat as much carbs as you want, just make sure you're matching the insulin." And that's the current recommendations by the American Diabetics Association, by most teaching in diabetic clinics. Eat whatever carbs you want, just make sure you're matching it with the insulin. Well, that's fine if you're selling insulin and you wanna sell more insulin, but if you actually wanna, attain better health and you actually wanna improve your patient's, control in their health, then no, you don't wanna do that. You wanna limit the carbohydrates and have a lower demand for insulin. So in those studies where they're just eating whatever the hell they want, but they're just mashing in the insulin and aggressively lowering it, they were dying, and this is likely because of how much insulin they were putting in their body and how this was causing issues, causing disease, and causing their body to shut down in various ways, and it was causing death in some of these cases. So, um, that's a problem with insulin, and so um, you want to try to mitigate the amount of insulin that you're using. So even if you can't come off insulin entirely, your body can't make insulin altogether, at the very least what this is going to do is help you reduce your dependency on insulin. It's going to have a much more even keel to your blood sugar regulation, and you'll just be a lot healthier as a result and a lot safer because you won't have those big swings.
it's almost like giving, Narcan, I think it's for heroin addicts, it's just like
Mhm.
giving them a permanent, um, Band-Aid, a crutch to lean on in order to continue their bad habits that's actually contributing to their deterioration.
Yeah. Yeah, exactly.
Sure. Dr. Chaffee, I always love
Mhm.
having you on, brother. Thank you so much for
Mhm.
joining me. Thank you for going into detail with all this. What do you currently have going on? I see that you have like a new membership, I think, on YouTube.
Yeah, so I have a membership program on YouTube. I sort of put out some videos on there and have live sessions with live Q and A's just with membership people in the members, so people can join that if they want. I also have my Patreon. It's just Anthony Chaffee MD, and then I'm starting a new challenge, sort of like a 3-month challenge, and we're sort of building that and putting that together. We're hopefully getting that ready by January, so people want to try this and have some support and a community sort of approach to this, well, with more guidance and Q and A's and things like that that we can work on with you. Then people can look into that. Um, Mostly just on YouTube and Instagram, and so, mostly on my day job, treating patients and, my practice, but, I try to be present. I try to put out videos on, YouTube every week and, post on Instagram and communicate through there, and so if people wanna find me, my YouTube as well as my Instagram are both Anthony Chaffee MD, and, so yeah, so people can find me there. I also have a website, just, dranthonychaffee.com, so dranthonychaffee.com.
Awesome, brother. I'll definitely include that in the show notes. You're not really hard to find at this point. So you're all over the
Yeah,
place, but yeah.
yeah,
Again, thank you very much, brother.
no problem. Thank you.